Hi everyone. So the first thing I'd just like to say is that it's a difficult position for all of us that live locally in the Greater Shepparton area to be back in lockdown, and I know that that can be a challenging time for people who, of course, we've not that long ago had a quite extended period of lockdown. So in addition to the normal things we're keeping an eye on in relation to COVID, I think it's really important at these times when things change quickly that we keep in mind that it can affect people's well-being, and I'd certainly encourage everybody to do those things that are important for them to maintain a strong well-being and healthy lifestyles and a healthy well-being, that's for sure. But if you are struggling, there is plenty of support available. So I'd encourage people to look at the coronavirus.vic.gov.au website. There's plenty of links and useful information there. And the Beyond Blue website also has some terrific resources for people to scroll through on their phones or tablets or whatever device. It's really easy to access that information. So if you are struggling a little bit, please don't hesitate to reach out for that support and the services that are available, because people are keen to help in that circumstance. So of course now in terms of the local situation for us, there's 34 active cases in Shepparton and there's 10 in the last 24-hour reporting period. 8 of those are linked and 2 are not, and they're still being investigated. There's approximately 400 contacts now that have been generated through the people that have tested positive in the last few days, and there's 16 households that are now involved in terms of having people that have active cases within those households. Very clearly, what we're starting to see now as a pattern in relation to the source of those acquisitions is movement between households. So it's quite simply, it makes it very difficult for the contact tracing team and for the broader community in terms of people not following the rules and as they currently stand in relation to movement between households. And that's not only movement in and around the Shepparton area, but we're also now, as things are starting to become a bit clearer through the contact tracing process, seeing examples of where people are moving beyond regional boundaries and certainly into Melbourne and travelling to and from Melbourne as well. So it's definitely at this stage, that's the primary way that the virus is spreading in the community, and it's the same in other parts of the state as I understand, but certainly locally. Please follow those rules. Do not go to anybody's house unless it's of course for one of the permitted reasons, which are a very small number of reasons. But we are seeing examples of where people are going for no real good reason and certainly not complying with the directions as they are in place. So please do not go to anyone's house locally, and do not go to other people's houses beyond the regional areas, and certainly in and out of Melbourne. In relation to inpatients, at the moment we have 5 patients admitted at GV Health with COVID-19, and again, people were seeing with the Delta variant that it does have a higher rate of hospitalisation. So again, if you're not vaccinated and you haven't made an appointment to be vaccinated, get on and do that straight away. It's really something that's quite simple for all of us to do in terms of getting an appointment to be vaccinated. And of course, again, through the course of the outbreak so far, we are seeing examples of where people are delaying getting tested from the onset of symptoms. So don't delay that. Don't even put it off by 1 or 2 hours. We are seeing, unfortunately, times where people are putting it off by 1 or 2 days, and then that just enables the virus to spread around the community. So I think they're probably the main things that I'd just like to cover off, and of course happy to take any questions.
Of the 16 households, how many of those are linked?
So 6 at this stage with known cases, but again, what we're seeing with the balance, or with the 10 that aren't linked, is that it appears there's movement to and from Melbourne, either people going south to Melbourne from this area or people coming north from Melbourne.
Should we expect some more exposure sites? Obviously, that's something that is key in playing this down again.
Yeah, we are. So there's a shift in focus in relation to how the exposure sites are being managed, and I understand people would like to know where and why and or where those exposure sites are. But as I said a few minutes ago, the primary reason what we're seeing at the moment about how the virus is moving around the communities between households is not a whole lot of evidence at this stage that it's actually transmission that's occurring through exposure sites. Certainly the tier 1 exposure sites are those that we are concerned about and will continue to be concerned about, but primarily the way the virus is being transmitted and the sources of acquisition are people moving between households. So quite simply, follow the directions and don't go to anyone's house unless you're able to under those directions.
Do we know how many cases are linked to that grand final party that was spoken about earlier?
No, that's still a work in progress. It's clear that there has been some local gatherings in relation to grand final day last weekend, and we know that that's occurred in other parts of the state. That's a new one that's sort of become evident in the last 24 hours and is still under investigation. And although Victoria is not a big NRL state, the NRL grand final is tomorrow, so if you're planning on getting together tomorrow, don't do it. We're seeing very clear evidence that those gatherings are dangerous in terms of transmission.
And the ages of a lot of the cases, are they more younger people that are travelling to each other's houses?
Yeah, mostly people, the profile at the moment is people in their 20s, 30s and 40s. Of course, a few weeks ago we had a higher proportion of school-age children, and that's not the case. It's more sort of the younger adult age group at this stage. There are some older people in their 70s, for example, but the bulk is in the 20s, 30s and 40s.
Obviously the restrictions this time are a bit probably less in terms of exercise, gathering vaccinated people, being able to go for a picnic, but just how important is it that people do follow those rules, for example, that 5 vaccinated people can go outdoors together?
Well, it's absolutely critical that those directions are really evidence-based, and the public health physicians in Melbourne really spend a lot of time developing and taking those approaches and trying to strike the right balance between having circumstances where people can come together and connect, but to do that safely. And but definitely, you know, if those directions are in place for a good reason in terms of not only allowing people to connect, but they're there to protect and reduce the spread of COVID as well. And that's the primary reason that we want to encourage people to make sure that they follow those directions on every occasion. And of course, those other things that we can sometimes see around the community, people perhaps have become a little bit complacent, you know, maybe not wearing masks at all, or not wearing them correctly, not sanitising. All of those things, it's the sum of the parts that make up the outcome and that we're all chasing. So they're really important, those directions, and people should be following them.
A few new cases around Shepparton in Benalla and Campaspe as well. Do you know if they're connected to Shepparton or they're independent?
So the Benalla one I'm not sure about, but the case in Campaspe, we do know that there's a connection between Shepparton as well. So and that's still being worked through, but that case became apparent, I think, towards around about Thursday last week.
Is that case Kyabra, Machuca, you know, any?
I won't probably speak about the town specifically, but it's on the eastern side of the Campaspe local government area.
Obviously, I think there's a real sense of lockdown fatigue that's really hitting people, especially the last few months, in the winter months and going now. But just how important is it that there is a finish line in sight in terms of that first 70% double dose for the state? Just how important is it that we stay the course and just stay positive and support each other through this as we did last time?
Yeah, it's really important. I mean, there's ways for people to connect either through FaceTime and phone calls and the like, or other video calls as well. So, but definitely, as I said before, if people haven't made an appointment to be vaccinated yet, they need to do that. And at the moment in the Greater Shepparton region, we're at around 46% or thereabouts, I think, on the double dose rate, and around 86%, I think it is, for the first dose. I'll just double check those numbers. Yeah, they're in the mid 80s for the single dose and the mid 40s for the double dose. So that's really, we are seeing quite clearly that the vaccines, whether it's the AstraZeneca vaccine or the Pfizer vaccine, and I'm sure it'll be the case with Moderna, that anyone who's vaccinated, it's much less likely that they're going to contract COVID, but those that don't become quite as unwell. And so really they're important things in terms of getting us to having a greater amount of freedom and normality back in our lives, but it's really critical that people get vaccinated. And I know, as I said before, being locked down again is a challenge for all of us, but thankfully at least the weather's a little bit warmer, at least today, and you can still do things outside. And I know there's people doing gardening or just sitting outside and having a tea or coffee and reading the paper can be those small little things that people find that to help boost and maintain well-being are really important at these times. And of course you can still go for a walk or exercise as well, and I'd encourage people to do that as well.
Are we still, I know I asked this last time about a couple of days in, are we still looking towards eliminating this cluster? Do we still think we can wrap our arms around it, or is it too unlinked and too disparate, whereas the last cluster it seemed pretty straightforward, the link and transmission? Do we think this one we can eliminate, or is this the point where Shepparton's no longer at COVID zero?
Yeah, I think it's going to become increasingly more difficult in the next few months for us to be at COVID zero. I mean, we got pretty close coming out of the last outbreak, but more and more as things start to open up, and particularly when we hit that 80% double dose mark, there's still 20% of the population that aren't vaccinated, and what we're seeing, as I said before, is the transmission is between households, so that's likely to continue. So I think people should expect that there will be COVID positive cases in coming months and perhaps into the early part of next year. The number's always going to be difficult to predict somewhat, but I think there will continue to be cases, and the best way to protect yourself is to get vaccinated.